So with us for a little while on and off doing what?
Let's talk louder.
Talk louder. Okay. Jody's been with us for a little while already doing our PRP and our platelet-rich plasma injections. She can come up so those of you at home can meet her. So Jody will be doing a lot of what we're talking about tonight, as well as other things coming down the line. So she's here tonight. Afterwards, if you have questions, I've told her she can feel free to chime in as we go tonight. But this is Jody, so that's who you'll see her around here more as she's doing this. So the goal tonight for those watching, for those here, we've kind of talked about this a little bit with each of you. But tonight we're talking about ozone and IV therapies. And the goal of tonight is really first, why these therapies? Why is this something that is important? How they work, and then what? How do we use them, when, where, what conditions, all those types of things. We're a small group, so if you have questions, let's hit it. Go ahead and ask anytime. At the end, if there's other things that come up, I'll hang out for the people that are here. If you have questions about you personally, we're more than happy to talk about that. For those online, if you have questions, send them in, and Quincy and Kylie will send them out when it's appropriate, and we'll get them answered. If we don't, we'll do like a Q&A email and send stuff out with the recording and stuff like that. So, all right. So some of you may be familiar with this stuff, but the way that I want us to start tonight, as we're thinking about everything, is to think biologically. So what do you think that means? We can interact here. What do you think it means to think biologically? Val, you're here and I know your name, so I'm going to ask what you think.
Well,
I know everybody's name here.
I mean, obviously it has something to do with biology.
Yeah.
So the how it works and interacts with the biology of your body, I guess.
Yeah, good. There's no right or wrong answer. Any other thoughts? Okay, so how does our traditional medical approach think when it comes to health? Again, no necessarily right or wrong, just thoughts.
What medication would you?
Sure. Yeah. Hey, come on in, you guys. So so often the current approach, and let's pull some chairs back for these guys. So often the current approach, and even in our world, when we're talking injuries, pain, etc., is we think diagnostically, meaning what name can we throw at this, and then what do we do for the name? And whatever that is, right? Tear, sprain, name of an infection, a disease, etc. Say, oh, you have X, so let's treat X. So the challenge here tonight, as we're talking about what we're doing to think biologically, is I don't necessarily care all the time what the name is that we call what you have, but really what's happening biologically, like you said, what's happening inside the body that's producing X, Y, and Z. And let's figure out how to support, treat those things, because that's what's actually going to help you get better and heal from injuries, pains, illness, etc. So as we dive into ozone and IV therapies, and for those that have seen me as a patient, this is also how I think when I'm working with you. Of sure, we can call it, sprain, strain, tear, give it whatever name we want, but really what caused that in the first place? And then what can we do to help make changes there so the body can do what it needs to do? This is a really cool diagram from an instructor that I went to recently. So is thinking about this biological cause, or a little bit differently, of really health is when all of our biological systems are doing their job the right way. Our body's made to be able to fight illness, to be able to heal, to be able to do all of these different things. But if both internal and external stressors are greater than what our body's ability to do and its job, that's when we have disease, that's when we have pain, that's when we have illness. You know, when I'm talking with my, you know, my athletes or my people that hurt, you know, muscle, joint, soft tissue, you know, you were lifting, you were running, you were biking, you were doing something, and you hit a line where that tissue could no longer handle the load or the capacity you gave it, injury happened. Same thing happens internally with illnesses and diseases. You can get an infection, we all do. We probably all have multiple running around in us, but if our biological systems are doing their job and they're working more effectively, more efficiently, and outweigh the stressors that we're going to get no matter what, that's when we're healthy. So in all things, the question should be, is what you're giving me supporting a biological system for my body to do its job better, or is this just taking away symptoms? Now, there are times where symptom control is important in the process, but the end game should be, let's fix causes and let's give the body what it needs so it can do its job to do what it's meant to do to get you better. So thinking biologically is what's going on inside, how are those systems functioning, and how can we help them do their job better? So in that context, let's dive in a little bit here. So I do want to address this for a second. And we say internal and external stressors. What do you think are some internal stressors that we deal with? Everybody deals with. We already said some of them.
Anxiety.
Yeah, great. Awesome. What else?
Stress.
Yeah, great.
Inflammation.
Sure. Yeah, awesome. Anything else? What about external stressors? We kind of named a few. Some. And by the way, stress isn't necessarily bad either. So working out, exercising is stress on the body. Can that get to a point where it's too much and makes you sick or cause injury? 100%. You know, dosage of anything can be good or bad. You know, we're going to talk about IV nutrients here in a little bit, but too much of any one nutrient can make you sick also. So, you know, this is just a list. There's probably way more than this. Stressors, internal and external, right? Infections, EM toxins are getting more and more. Emotional, we talked about that. You know, these last 2 years, probably seen more of that than we have in a little while in our culture. You know, we see a lot in here, injuries, deficiencies, pain. Pain is definitely a stressor, you know, and then our biological systems, this isn't all of them, but it's a lot of them that are supposed to, that are made to deal with those stressors. And if they're not able to do their job the way they're supposed to, injuries, illness, etc. comes out. So, so really, this is what we're here to talk about. And again, my thought process in everything we do is causes don't equal conditions. Unfortunately, we live in a world that is driven by payers, and insurance wants to know the name of the condition and a letter and number code for that condition. You know, I'll have patients ask me a lot of times, you know, got hip pain. What is it? Well, it's not a labral tear. It's not this. It's not this. It's not this. So what is it? And I'm like, well, diagnostically for your insurance, I can call it something, but really this is why you have hip pain. And that doesn't have a name, but this is why you have hip pain. Same thing. Why do you have the symptoms that you do? Why do you have chronic fatigue? Why do you have allergies? Why do you have, you know, migraines, headaches, you name it. You know, we can give all the names to those conditions that we want, even names of infections, but what's the cause? You know, is it fibromyalgia, is it MS, or is it a bacterial infection that's causing that? Is it a deficiency in hormone production, GI availability, or really any number of those all put together? So, so let's start with ozone. So let's talk about what ozone is first. Who here has heard of or has experienced ozone therapy in some shape or form before? I know some of us have. So we'll talk about this a little bit later. There's actually a lot of ways to administer ozone. We're not going to do all of them in the clinic right away, but there's a lot of ways to do it. We won't dive into the history of ozone, but ozone has been used medically for over 100 years, almost 200 years. Those that really care about stuff, guys like Nikola Tesla were using ozone medically way before they were using medications and antibiotics. So ozone has been around for a long time. What it is a gas. You know, a lot of times when I ask about ozone, people are, I don't know, stuff like way up in the sky. Yeah, we have ozone up there to protect us against the radiation that comes from the sun. And that's its purpose up there. When we use it inside of us, it does a lot of things, and we'll talk about that. It is O3, so it's different than oxygen, which is O2. So those of you that remember back to like high school chemistry, it is different. It is polarized, which is why it reacts so quickly, so immediately, and so effectively in the body. So it is a gas. So we are injecting gas, IVing gas, insufflating in different orifices in the body, gas, with really amazing healing results. But again, this is not drug therapy. This is a big phrase, biological response modification therapy. It's like you just said like a million syllables in one phrase. So if you go back to what we talked about, it is a therapy that helps to modify the biological systems in your body to do their job. For instance, if you really dive into the ozone literature for immune system, for instance, ozone is considered an immune system modulator. And I'll explain what that means. So a lot of times people live with a lowered immune system activity. So their immune system is deficient. So ozone actually increases immune activity. Well, if that's all it did, then we've got a problem with autoimmune conditions, which means your immune system's overactive. But since it's a modulator, it brings your immune system down if you're in a hyperactive autoimmune state and modulates it to do its job the way that it's supposed to. So that's basically what the basics of what ozone does. Is ozone doesn't necessarily by itself do anything other than it makes the body do its job better, makes those systems we talked about do its job better. So going back to what we talked about, injuries, disease, especially the more chronic they are, why are they so hard to treat or cure? Well, most of the time it's a complex of any number of biological imbalances at the same time. I'll talk with patients who have had chronic pain for a really, really long time, but then if we really dive into it, they've got gut issues, they've got diet and hormonal issues, there's neurological issues going on. So there's multiple systems that are on the fritz. And, so we can, rub, tape, needle as much as we want, but healing won't ever be complete until we get all of those in balance. So that's kind of what the rest of this slide says. Especially with different illnesses, we live in a culture again that loves symptom relief, but to really treat and heal, it's identifying where those imbalances are, and then how do we use the right tools in conjunction at the same time to help support the body to do its job to take care of itself. This is a really cool chain of health that I came across. But to start getting your mind of what ozone helps with, ozone actually helps all of these things. Helps increase metabolic activity, fights every single type of infection you can think of. It modulates and basically gives the immune system the fuel to do its job the way it was meant to. We increase circulation because of the oxygenation that's happening. Fights pain, detoxifies the body. So ozone is going to basically help modulate every system to do what it's supposed to do. Neat fact, we'll talk about this. Well, since we're talking about IVs, we can use ozone with other therapies. So different injections, we've been doing PRP. We can do a PRP and follow it straight up with ozone. You can do ozone followed up by a nutritional IV drip. And because of what ozone does, it'll increase the effectiveness of whatever therapy we add it to. Basically gives the body, it's almost like it preps the body for our kids. Yeah, Mark, yep, that's right. I am a superhero. Let me go change in the phone booth, you know. So again, reiterating the fact that ozone, I always want to be really careful saying that something helps everything, but ozone's one of those things that pretty much almost does. And I chose not to get like super into the cellular physiology science tonight. But the reality is it gets into your cells and it basically makes your cells do their job and give them the fuel to do their job the way they're supposed to. And so because of that, all the functions improve. So let's talk about this a little bit more. So why is oxygen in the body so important? Well, the ability to your body's ability to use oxygen is really one of the main definitions of health. If we can't utilize oxygen, another really common term you'll hear out there, especially in the fitness world, is aerobic capacity. Same thing. Basically, how well can your body utilize the oxygen that it takes in? That's not just in your lungs, it's now in every cell. Can it utilize those molecules to produce energy, to produce what those cells are supposed to do? And so you will hear ozone and some of these IV drips talked a lot about in anti-aging. I talked with a patient about this the other day who said, I don't care about anti-aging, I care about how I feel right now. So this comment about, you know, when you're 20 versus 70, your ability to use oxygen decreases. So the longer your body has imbalances in biological systems, aka chronic pain or chronic illness, what happens scientifically, let's dive a little bit here. Your mitochondrial function and density decreases. You know, for those here anyway, when I say mitochondria, do you know what I'm talking about? They're like, I remember in high school, they called them, the powerhouse of the cell. It's what makes ATP. And without that, your body can't do anything. And so, you know, we know as you age, that density and that function decreases naturally. But now you want to talk about somebody who, you know, I'll share a really good example. I've got, you know, patients that I've seen that were teenagers and tore their ACL 3 times before they graduated high school. That girl is going to have decreased mitochondrial density systemically because of the trauma that's hit her body. So in theory, biologically, will she age faster? Yes. Chronic pain, chronic illness, your body is actually aging faster because it's working harder to do what it does. This is why you'll hear these places that do like, what's your biological age? And it's like 70. And I'm like, but wait, I'm only 37. It's like, yeah, but you've been fighting something or dealing with chronic issues for a really long time. So your ability to use oxygen actually makes your body work worse if it does it poorly. So if we can increase your oxygen utilization, then we can heal you faster. So for instance, those of you that come in, we've worked, you know, neuromuscularly or skeletal musculoskeletal on things. A lot of what we're doing is to improve blood flow, circulation, so we get better oxygenation to the tissue. That's a huge part. That's what movement does, right? You exercise, you get more oxygen to the tissue, things heal, things regenerate, things improve. And we have to be able to do that locally and systemically. Any questions about that? It's kind of like a little bit of a deeper dive. But the idea here is, this is like, I tell people oxygen is the high octane fuel for your body. And if we can get more of it in, it's going to work the way that it's supposed to. So just kind of another way to look at this, oxygen utilization directly affects everything. You know, we talked thoughts, cognitive, tissue repair, senses, organ function, hormone, digestion, reproduction, everything. How well your body uses oxygen directly relates to how your body does everything else. So this is where ozone, and those of you that have been in the clinic, and we also use hyperbaric oxygen therapy, are awesome ways to increase oxygenation. Huge list of things that decrease oxygen utilization. I'm not going to go into all of it, but those things we talked about: stress, nutritional issues, hormone issues, injuries, pain, inflammation, your body's ability to digest food, medications, all of this stuff can decrease your body's oxygen utilization. Okay, So that said, knowing all that, ozone does what it does, but it's not standalone. It's like anything else, right? We can tell you to, take vitamin C every day, but then if you hang out around a lot of sick people, you eat like garbage, and you don't exercise, you're still probably going to get sick, right? Vitamin C is not the cure-all. Ozone supports everything, but your diet, your hormones, foci, so things like scars are an issue. Stress control, that should be life control, right? If there are things going on, if we're not sleeping appropriately, then we can pump you full of as much ozone as we want, or anything else for that matter, and you're still not going to get better. You might feel better for 24 to 48 hours, sure, but if you go right back to the 84-ounce swig or whatever they give over there, it's going to counteract basically everything we just put in. So so now let's get into like what we're really talking about. So this of course isn't everything. I'll start on the right side of this slide. Metabolic stimulant, so will increase energy, pretty much everything. It will kill every bacteria, fungus, virus, parasite that you have in there. So those of you that have had Ozone IV before, this is a huge reason why. It's almost like you're dealing with a chronic bacterial or viral infection or fungal infection. Your missionaries, for instance, that come home from who knows where with who knows what, that snagged a ride home on the airplane, they will kill all of it. So in some ways, it's like dropping an antibacterial nuke inside of your system, and it'll kill it. There's a lot more to that we can talk about offline, but it's huge that no resistance, your body will not fight against it. Unlike most medications that have a purpose, your body does resist almost every chemical you put in it, except for oxygen, oddly enough. So now let's talk about the left side, because there's some more words there, but I think this is the stuff that's really interesting. Increases ATP production as much as 40%. So energy, yes, as far as feeling good, having energy, but also energy for your body to do what it's supposed to do. We talked about this a little bit. So increased cytokine production. In short, cytokines are the things your immune system puts out there to fight everything. And this last one, you can read all those initials. Basically, those are all the things your body produces to regrow tissue. So when somebody says it's a regenerative therapy, it's like, well, cool, but what is it actually doing? So ozone actually increases your body's release of growth factors. So when I'm injecting in a tissue, we know that we're actually stimulating your body's regenerative response to regrow tissue in that area. So it is considered a regenerative therapy. Any questions about this slide before we go on? Anything coming in from over there that's worthwhile?
Nothing.
Okay, yeah, bring your questions on, it's okay. Okay, so methods of how to administer it, there's a lot that are extremely effective. What we will be doing in here, it's kind of 4 or 5 down, ozone injections we've been doing for quite a while. Some of you in here have had those. Quite literally, we fill a syringe of ozone, of a gas, and we inject it into joints, into muscles, tendons, ligaments, and have awesome results. So everything from arthritis to tears, to trigger points, to all of the above, chronic pain, ozone injection to the spot, because if we put an IV in, it's going to get in the system, but if I can get directly on that tissue, that's where some of that regenerative piece comes in. The one that we're also going to be doing that we'll talk, that really is what we're talking about tonight, is the first one. That stands for major autohemotherapy. So that is IV. So we are administering ozone through IVs. Let's talk about what that looks like. Again, I know a few people in here have had that. Quite simply, what we do, we draw out blood, we put it in an IV bag, we take syringes of ozone, so gas, we put it in the IV bag, we gently mix it up, hang it, and drip it back in. And we're putting now that oxygenated blood back in your body to do all the things that we've talked about so far at a systemic level. Depending on the person, these can take anywhere between 45 to 60 minutes. We usually follow it up by a glutathione drip, which we'll talk about in a little bit. The antioxidant tends to help the effectiveness of the ozone. But that's it. We sit in a chair. We, this is what Jody's going to be helping with this. Do the blood draw, hook you up, drip it in, hang out, sleep, read, watch, do what you need to do. Yeah.
This might be a stupid question,
No.
but for somebody who's like polycythemic and needs like to have blood drawn out of them, do you have to use blood to put the ozone in, or can you use it?
Good question. So they used to do just straight ozone IVs. The risks are extremely high. And so they really don't do it anymore. There were some clinics that were still doing it, and it's success. I mean, it works, but the risks are way higher. And so there are some places that will still do what they call salinated ozone. So basically they just ozone saline. Still effective, but still the risks are higher. So this is the most common, the safest, and the most well accepted in the literature and the medical community is doing it this way. But you're right, there are issues. So there are very, very rare blood conditions, and so there are people that have them that you have to be careful with. So that's where, we can do injections and things like that to get as close to a similar result as possible. Good question though. Those populations that we really worry about that are so small as far as minority populations, but those conditions do exist. Yeah. Good question. One other one that we do in here, and we'll probably start doing more, is ear insufflation. And we put like a stethoscope in your ears and let the ozone run. We will probably start doing some sinus insufflation as well in here. So this brings up a good point. A lot of people say, isn't ozone toxic? I'm going to put this in the slides, but let's address this. Everything is, again, with the right dosage. They have shown pretty much toxic exposure to ozone as far as inhaling it. You've basically got to work in a factory 40 hours a week for like 40 plus years before you have negative effects from it. So there are techniques where we can shoot it up your sinuses and help you clear it to help with allergies, chronic sinuses, concussions, headaches, those types of things. So it is possible.
What do you use ear for?
Ear? So yeah, so I just mentioned a few of them. Same with sinuses, but same thing. So we've used it a lot already with headaches, migraines, concussions, any type of cold, virus, bacteria. We personally have used it with us and our kids. If you feel a cold coming on, we come in, we put them in there, you sit in there with a few minutes, you'll smell. So if you haven't smelled ozone, it has kind of like a chlorine type smell. You'll know it when you smell it. We try to do what we can for you not to inhale it, even though it's not bad. Those are some of the main ones that we've seen really good success with. A lot of head conditions, colds, upper respiratory, ear infections, headaches, all those types of things. Concussion's been one that's been really interesting for me to watch. Ozone help. Ozone has really helped conditions. We have limb bagging might be one we'll do in the future. This is where literally it is what it sounds like. You put your foot or your arm in a bag, we cinch it off and pump ozone in there. So burns, skin infections, cuts, wounds, it will heal and it'll kill any of the infection in there. So they started using limb bagging with like diabetic ulcers and burns, but I mean, whatever you put in there, it's going to help heal or kill whatever infections on that. So any questions about administration? Really, the main ones you'll see us use here in the movement clinic: ozone injections, the IV, so the major autohemotherapy, And then from time to time, we'll use ear inflation when it's needed. Yes.
Yeah, we've got a couple from people online here. So can you do both IV and spot injections?
Yes. There is a point where you can do too much ozone in one day, but it's a lot. It's a lot. I can tell you personally, I've had multiple days in a row of high dose ozone IV with ozone injections on the same day. And it's fine. You'd have to work really, really hard to get too much. Now, that said, there are some ways of exposure where, depending on the person, and this is where it comes to answer the question, everything is, it depends, right? You know, if we're dealing with somebody, if the patient is extremely chronically ill, to the point of, there's disabilities, there's major issues. Now it's all dosage, right? And it's all dosage. So how much we're putting in an IV and the injection, it's figuring out dosages day in and day out. Now you metabolize it almost immediately. So, I mean, that's why we can do IVs or sometimes day after day after day. But really the only thing we're worrying about is your vein integrity at that point. Of what, just making sure veins are healing and not blowing and all that type of stuff. So hopefully that answered it. The answer is yes, but it depends.
And then just one more. So how exactly does it help with neuropathy?
Yeah, good question. So, going back to a few things. So at a cellular level, so neuropathy is due to a few things, and it depends. There's a few different types. The big reasons we get neuropathy, one is neural inflammation. So inflammation actually in the nerve pathways, in the nerve tracts. This is going to help kill that. Two, another big reason why we get neuropathies, especially the ones that we hear most common, your feet are starting to go numb and tingly in sleep, hands and fingers, we're starting to lose feeling or control. What's happening is the myelin sheath, which if this is your nerve, the myelin sheath is basically the tissue that wraps around the nerve and conducts how fast the nerve works. So think about power cables that run overhead, and the ones that carry the most electricity and have to carry it the fastest, the farthest, have a thicker conducting substance wrapped around it that basically makes it so that electricity can go faster. Same with your nerves. So neuropathy is due to the degeneration of that myelin sheath. And so ozone is going to help regenerate that, as well as on the cellular level. Again, even your nerve cells have mitochondria that have to produce ADP so they can do their job. And so nerve cells are starting to die, lose their mitochondria, and not be able to function in neuropathy. We're able to help heal that and produce some neurogenesis, so increase new nerve growth, so that we can change how your nerves both centrally and peripherally function. So hopefully that answered that.
Perfect. Thank you.
Yeah. Okay.
Are you going to address pro-ozone?
Not tonight. So what can it be used for? We've kind of talked about this, almost everything. Stuff that we really see and deal with in here. I don't see a lot of gangrene in here, thank goodness. But chronic fatigue, acute and chronic infections, injury, healing, pain, neurological conditions, concussions, sinuses, autoimmune, prevention, recovery, wellness. This is a good one. So I don't have anything wrong. Will ozone still help me? You betcha. You bet, because it's basically turning all your systems up. So is there an argument for a quote unquote healthy, well person to get ozone, once a week, a couple times a month, once a month? That's kind of a prevention, recovery, wellness. Yeah. If you're an athlete and you're training really heavily, will this help recovery time and repair tissue? 100%. So, so again, what can it be used for? Lots of things. I've met with doctors who run oncology clinics, and they use this. Europe has been using this to treat COVID acute and chronic long haulers with extremely high success for a really long time. And they've actually published studies proving that it works better than all of the other options. So, so what can be used for almost everything. So before we move on to IV, other therapies, any other ozone questions?
Are
Okay,
there
what we
any
got?
side effects or recovery after the treatment?
Okay, so any side effects or recovery? Almost none. Probably the most common is headache and fatigue. And this is where dosage comes in. So those of you that have had Ozone IV before, and I know there's some of you in here and some watching. Though, and you guys probably tell me what you guys feel, but I would say most of it's those two things. And really with any IV infusion, those are kind of the most common side effects are fatigue and headache. And so this is where dosage and speed of the infusion come in. So sometimes we can slow down infusion to help headaches not happen as much. Ozone is all about dosing, where we can start really small, watch how you respond, and get you up to, they kind of call it like the highest tolerable dose. So my goal is not to give you an Ozone IV and then you can't function for the next 5 days. We should be doing it at a dosage and a frequency where it actually helps improve. But can you feel fatigue? Can you feel headaches and stuff like that afterwards? Sure. Other than that, and we're talking about segue into other IVs. The most common side effects in general for any IV, headache, fatigue, site tenderness or soreness after, you had a needle sitting you or a catheter sitting you for a half hour, 45 minutes, 60 minutes. And so you can be tender, bruised, itchy, and that's pretty much it. Anything that you can think of beside those? Very, very few. I mean, guys, this stuff's really safe. Yeah, it really is. And we have to do a lot of things really, Jody and I have to do a lot of things really, really wrong for this stuff to not be safe. But if you get it and you feel later that day, like kind of a headache coming on, it's not uncommon. A lot of times this stuff helps with the headache. So question and then question.
Yeah, I don't know if this is right or not, so I'm asking, but I've heard that a lot of like the brain fog and fatigue comes from the just profuse amounts of growth factors that you're delivering. Is that
oh man, so
contributory to
big
it?
conversation. The easy answer is yes. The easier answer is brain fog, chronic fatigue, whatever you want to call that. I see it a lot. It goes back to stuff we talked about, and more often than not, it's from 2, 3, 4, 5 or more things wrong in the body. It's never really one. This, to be honest, this is one of the things that drives me crazy. And there's a couple of you in here, but I've talked to multiple over the years, several. And Jody, I know you deal with this too. Middle-aged females that deal with this stuff that we're talking about, chronic fatigue, brain fog, poor memory, whatever. I talked to a lady about this yesterday. And what does doctors say? Well, you're just, you're a mom and you're a woman in your 40s and menopause is kind of on its way and that's just kind of the way it is. And I want to like kick that doctor in the face, right? It's like, no, this patient is coming to you for help and probably has half a dozen systems that are not functioning appropriately. So yeah, are there growth hormone issues? Are there other hormone issues? 100%, right? Are there detoxification issues? 100%. Is there almost always an underlying infection that's causing all the rest of that? 100%.
Sorry, I think I was more saying like for like NAD plus or the ozone that can increase like neuro brain derived neurotrophic
Exactly.
factor.
And
Can
we're going
those
to talk
cause
about
the brain fog and stuff like that too post treatment.
No, because those are
Okay.
usually enhancing it.
Gotcha.
Those are usually enhancing. We're going to talk about NAD in a second, but those are usually improving the function, not flooding it to the point where it's going to cause issues. The headache more than anything is because we're dumping a ton of stuff into your bloodstream and your body's trying to deal with it. Yeah, you had a question.
Yeah, I'm just curious, why does the ozone hurt going in sometimes and not always?
Yeah, good. So this is a good question. Joe, you can chime in here, because I think it's the same with any infusion. I think a lot of it has to do with how it's placed. A lot of it has to do with your vein health and your vein integrity. And some of it has to do with your current health in the moment that your body's dealing with stuff. Because and dosage. I'll tell you dosage of ozone. I won't get into how we dose it, but there's different concentrations, and I can dump in a really low concentration of ozone in injection or IV, and people don't notice anything. Even on like if I'm injecting a knee with ozone, if I up the concentration, you can get to a point where it's so high that it's uncomfortable. So that could be one of the leading factors too, because I know the clinic you're talking about where you've had this done, whether it looks like it or not, they are playing with concentration and dosage for you based on what you need at that time. So there are times that it could feel a little more uncomfortable because we've upped the concentration a little bit. Yeah, feed.
So when you're saying that you mix it in the bag with your blood, my first thought is like, is there any chance of clotting the blood, like it goes back into you?
So good question. When we mix it, there is some heparin in there. So those that care, it's a very small, but you basically charge the syringe that we're drawing the blood with a little bit of heparin. So almost never. And those of you that have, especially talking to you two that have done this, if there is a clot, it's more likely going to happen at the catheter site than it is in the blood. But yeah, you charge the syringe with basically like 1 to 2 mLs of heparin. And so it's gonna, for those that don't know, heparin is an anticoagulant. It's the most common out there. You don't know this, but everywhere you go and get your blood drawn or whatever, it's being used everywhere. So yes, that's how we combat that. Good question. Did that help answer your question? Did you have a question?
So side effect from ozone, can it cause like a detox?
Yeah, so if anybody that's familiar with the term like detox or a Herxheimer reaction, yes. And because we're killing stuff, if you have an infection, whether you know you have one or not, bacterial, viral, fungal, parasite, what happened, I'll give you the basics. When we dump something like this in here, even when you take an antibiotic, it's not like it magically makes all that disappear. If you know how your immune system works, basically, especially with bacterial infection, it gets into that bacteria and basically blows it up. Well, those fragments still have to go somewhere. And to put it in like terms that are kind of personify it, the bacteria kind of gets ticked off that you blew it up, and it'll go other places and cause other issues. So a Herxheimer reaction is basically that. If we're killing something, the thing you're trying to kill almost fights back because it doesn't want to be killed. So feeling cold or flu symptoms afterwards is signs of a Herxheimer reaction. Even headache and fatigue are. The hard part about this is that's a good sign because it means it's doing what it's supposed to. But this is why chronic illnesses are really hard to treat, because you can kill it at one stage of the bacterial growth, but it's still doing other things. So if you have questions about that, let's talk individually, because there's ways to go about that in a lot deeper conversation there. But good questions. Anything else ozone before we move on? Okay, great questions. Okay, IV therapies. Whoever has gone and gotten like a vitamin C drip, Myers cocktail, antioxidant, glutathione, or whatever. Most of us, a lot of us in here, I have. Okay, so that's what we're talking about. Who has heard the term "you are what you eat"? Everybody's nodding. So is that a true statement? It's kind of a trick question.
No.
Oh, good. No, you are what you absorb. So you can eat the healthiest diet in the world, but if you can't absorb it, it doesn't matter. If there are prevention in your GI tract to absorb that stuff, it doesn't matter. I'm not going to get into the decrease of our soil quality in the United States, but that's a huge piece of this also. And if you're eating anywhere close to the standard American diet, which most of the people who we see in here are not, you better believe you're not absorbing the stuff that you need. So, and if, 5 of your biological systems, your hormones are off, all this stuff's off, you're not absorbing what you need to. So this is why this gives the argument, but also the proof of why IV nutrient therapies can be beneficial for the right people, the right time, with the right nutrients. Better bioavailability of nutrients. So, by the way, your GI tract actually is very selective about what it absorbs, and it will not absorb everything. It's meant to prevent things from coming in on purpose, good and bad. So we can actually, what IV does, we can infuse 10 to 20x the amount of nutrients can get absorbed in your body, and then they are just by eating, and also, by the way, by taking a multivitamin. Sidebar tangent, there's a huge study that came out almost 10 years ago now. You can look it up. It was published all over the place, where they did a huge study on basically every single supplement in every single big box store, Walmart, Costco, Target, you name it. And I can't remember the number, but it's something like 97% of those supplements had nothing in them that the box said it had in it. So you're basically taking chalk, a bunch of chalk. So, whenever somebody comes in, they're like, oh, I got like a great calcium supplement. Where'd you get it? Costco? Sweet, you're eating sidewalk chalk. It's not doing anything to help you. So, I am always a diet nutrition first person. I want you to be able to get as much as you can from your diet. People ask me about supplementation and things like that all of the time. I'm going to ask about their diet, their sleep, and their activity first. Let's make sure you're eating the way you're supposed to be. But again, there's all these issues biologically where IV therapy can come in and be a huge adjunctive help in treating and supporting the body, depending on what we're trying to do. Okay, so back to this. We're supporting the biological systems here to create health, not necessarily fighting disease. So probably the most common that I've seen and heard over the years, I'm familiar with a lot of the groups that have been doing this. Jody, I know you're familiar. I bet like immunity, high vitamin C drips are probably the thing that people are signing up for when they get sick, when they don't feel good, have COVID, whatever. None of that's fighting the infection. It's supporting your body to fight it for you. Now, if we combine it with ozone, it is. But the drip alone is just trying to give your system the nutrients so they can do their job. So, any questions about that? I feel like this is a little bit simpler topic, right? We've all kind of heard of vitamin C. We know to a point what B vitamins are. We've heard of them. And so for the rest of this, we're going to have a range of blends, but also vitamin, mineral, drips, additives, as well as intramuscular injections like B12 injections and stuff like that we're going to be able to offer here. Instead of going into everything, I've chosen a few of probably the more common ones that you may have heard of, probably some of the more common ones we will be using to talk about in detail, summarize a couple of the other ones, and then we'll finish with questions on here. When they're done, we can probably shut those off, and if people here have individual questions, Jody and I are happy to hang out and answer those for a little while. But before I dive in, any questions about why IV nutrient therapy is actually a thing? Okay, the other caveat I'll say right now, so if you've been watching, there are what I will call IV bars popping up all over the place, and people that don't even come to your house. I've been to them, I've tried them, and almost always what happens is it's like you sit down at a restaurant, they hand you a menu and they say, what would you like today? good thing I knew what I was looking for because I could choose. But there's a huge list of stuff that like, it's like, do I need selenium? Do I not need selenium? Sounds good. Throw it in there, right? Jody and I, in our approach here, what we're going to be able to do is, our goal is to use this as how can we actually treat and support you based on what you have going on. So when necessary, we're going to run labs to see where your levels are, to see what you can tolerate or can't tolerate. There is such thing as too much. There is such thing as mixing too many things at one time. And so we're coming about it as we're going to use this to actually treat and help and support, not just what do you feel like today. You know, if we know you, and again, there are some things that are pretty benign, you know, if you're fighting a cold or whatever and you want immunity, those things are pretty easy to just say, hey, come in, sit down, and let's plug you in, you know. But we can do so much more for you, for what's going on, for your friends, your family, if we actually figure out what's going on inside of you first. Okay, so let's go through some of the most popular common. So Myers cocktail, this is not named after me. That is not how my name is spelled, although I did get a flyer today for a new IV place that did spell it after me. I think I'm going to text them and say thank you. This has been around for decades. There was a doctor that created this, and it's been used for decades and decades and decades. Probably one of the most common IV blends that's out there. You guys that are here can see it, but what is it used for? Really lots of things. Chronic fatigue, depression, anxiety is not on there, but that's included. Lack of energy, dehydration, immune support for acute and chronic, by the way, headaches, migraines, sinus allergies, and acute muscle spasms and injury. So holy cow, a lot of things. And that's probably why this is one of the most common, most well-known, well-used, and has been. I mean, you can go to a hospital and they're going to know what a Myers cocktail is. EMTs are going to know what a Myers cocktail is. It's used. It's very well known, very, very safe. What's traditionally in it? Magnesium, calcium, a bunch of B vitamins, B complex, and vitamin C. This is where labs become important. We can add to this other things if you need them. If there's reason to add a glutathione or to add another nutrient in there, we can based on you. This is where the guesswork and the menu stuff becomes dangerous, but where what we can consult with you, get to know you, we can add things that that could help you personally. So again, you can go get a Myers cocktail and a pill. They won't call it that. They'll call it a Centrum, right? That has this and 100 other things in there that you're just going to pee out because it's chalk. But this is going to actually get into your system and do its job really effectively. Any questions about these? Who's heard of a Myers cocktail before? Most of us, yeah. It's probably the most common one out there. Who's heard of a ringer? Anybody heard of like a banana bag or a ringer? So other than that's like EMT arrives on the scene, you're passed out, or hangover is the really big one. They're gonna drop that into you really quick. This is probably the most common outside of that people are using or heard of. And this, by the way, combined with ozone, we're gonna be able to help in a lot of different ways. Okay, NAD. Who has heard of NAD before? A couple people. So I decided not to put the pictures of the Krebs cycle and electron transport chain up on here for those that have taken biochemistry. Really simply, NAD is a coenzyme, meaning it plays a huge role in the chemical reactions in your body that break down nutrients and produce energy. If you don't have a good ratio of NAD in your body can't do those things. That's kind of the simple way to put it. So oxygen's the fuel. NAD is like the fuel additive that makes it do its job better. If it's not there, those chemical reactions just don't happen. So there's a lot on here, but it's naturally occurring. It plays a role in generating energy. you know, the most important cofactor in improving mitochondrial function because of what I just said. It's also helps the liver break down fats. Again, this plays into how the body produces energy. It has to break that down so we can use it. Creates ATP, which is the energy molecule. So by boosting NAD, it really can help a lot of things. Again, biologically. So people say, oh, will NAD help my MS? Well, yeah, but it's not treating the MS, it's helping the system, right? Will NAD help my Lyme disease? Will NAD help my concussion, my long haulers? Yes, but it's not helping the name, it's helping the cause. Highlighted in yellow, these are probably, if you dig into the research, the medical literature is going to say it improves mental clarity, alertness, concentration, memory, and improve athletic endurance, and reverse the symptoms of chronic fatigue. So since we're on the possible benefits, so again, increased metabolism, increased energy, huge in pain alleviation, inflammation. This is a big one that we won't deal with a lot here. I have a patient who's a clinical therapist. I spoke to him about this. And there are clinics that they use, NAD actually has been used for a very, very long time in addiction recovery. If you have questions about people you know, I can point you in the direction. It's using NAD high doses for a really long period of time, but relapse rates are less than 10% in most of the literature. So, anyway, so it's going to protect and correct DNA damage. Here's that anti-aging word. So I've seen a lot of these IV bars advertise NAD as in the anti-aging molecule. Well, cool. I don't necessarily care about, I'm going to age, but I want to do it without chronic fatigue. I want to do it without PTSD, anxiety. I want to protect and heal my cells and their impaired function. It will help with better focus, memory, and better sleep. So your question about will the infusion cause the brain fog? It shouldn't actually, because it's actually making those functions work better.
Gotcha. Yeah, I think I'd read that just in this study somewhere because I was interested in doing it, and they mentioned just because of how significant the increase was that they did just a little bit of brain fog post treatment.
Yeah, so
kind of alleviated it.
And I know you've been around it longer. I've never had it done. I've talked to a lot of people who have. I will do it. So FYI, if NAD becomes something that we use, the dosage that we will be using takes about 4 hours. It's a 4-hour infusion. It takes a long time. And part of it is because it makes you feel weird. And so it's a very slow drip, but it's extremely highly effective. Now, again, this is the tool that we're using to treat. I had a patient, guy's got an awesome story, but still deals with some long hauler stuff and some neuropathy. He researched NAD, he called this place, and they're like, I don't know, you could do it like every day. And he's like, well, A, it's like several $100s. B, can I safely use it every day? And they're kind of, we think so, like, come on in. And so he didn't do anything. So that said, there are protocols, especially in the addiction recovery and the neurodegenerative, so like Parkinson's, Alzheimer's, where they are doing this every day, 6 hours a day. For 90+% of us, we're never going to need to do that. For relatively healthy individuals, you could do it once a year, and the benefit will last a really long time, or a couple times a year. Now, is it preventative? So for instance, myself, I know that I have Alzheimer's, dementia in my family. Does the research show that NAD can help prevent that? 100%. So am I going to use it? For me, 100%. Not to mention, almost everything else up there. So this is where, working with Jody and I have decided, and I've had patients ask already, hey, is this something that I need? The answer could be, well, the answer depends. Some of the patients I know I've talked to, we've said, yeah, this probably should be in your plan, but maybe starting at once a month, every other month, depending on how, we might get them. I bet we will never see anybody sick enough severe enough where we're doing this every day. Jody,
I just want to just throw out there, just to think about this on like a, just, when you talk about how this is treating, they can treat everything, right? So think about it on a cellular level, like completely cellular. We are supporting ourselves. We are supporting how well they function. And when they function at their utmost potential, then we will feel better. Our body will be able to heal itself. The inflammation will come down, all of that. So if you think cellular level, that's what we're not necessarily treating the disease. We are treating, we're helping your cells to perform best. And then the studies, the training that we were watching, and it talked about our mitochondria and has just normal aging process. Our mitochondria slowly, it slows as we get older. So it's harder to fight infections. It's harder to fight, it's harder to heal, it's harder to recover. So this right here is a perfect example of helping keep that mitochondria functioning. So we have more ATP, which ATP is the energy. That's what drives our cells. That's, like we said, the mitochondria is the powerhouse. So if that is working appropriately, then we can mitigate and decrease the fatigue. We can't, or it's not gonna be this magic, haha, but we want to, instead of running at 65%, hopefully we're running at 80 now. And, you know, and then that continuation of all the other things with the ozone compiled with it and this game plan, you know, putting forth a game plan of how we can get us feeling going from 65% to 80%. So that we can enjoy life, we can enjoy the sports that we like to do, we can play, we can be with our kids, grandkids, and hopefully decrease having to go to the doctor, decrease having cardiac problems, decrease having strokes, those kinds of things, and ultimately having this help, you know, promote it so that we can continue to exercise, which we know helps, which we can keep all of that thing. So that's what I love about this is not, we're not necessarily treating disease, but we're helping our body be as healthy and function as healthy as it can.
awesome.
So that's my 2 cents.
Thank you. For those that are thinking about injury, right? So musculoskeletal, all this applies too. The reality is, if your metabolism sport, if you have lots of inflammation and your body can't produce energy, it's going to take you a lot longer to heal. So, and that's from simple sprain strains to disc issues, to tears, to surgeries, to fractures, to all the above. So good thoughts. Any other questions about this? Now, I will tell you, if you say you have chronic fatigue, you don't sleep, but it's because you're up playing like Call of Duty all night long, that's got to go away. The NAD is not going to majorly fix you if you're playing Call of Duty till 3 in the morning. I know who you are, okay? No, no, I had a teenager in here who was, you know, dealing with stuff, and you know, highly good athlete, and you know, we started asking some questions and come to find out, like, she stays up till like 3 or 4 every morning, and I'm like, you're not gonna heal. Like, we can do whatever we want to you, and you're not gonna heal. Oh, and by the way, your athletic performance is gonna suffer. So this goes back to nothing's a standalone treatment. Okay, one more that will go into a little bit of detail on glutathione. Who has heard of glutathione before? So glutathione is basically like the master antioxidant. There's lots of antioxidants out there. This one's probably the biggest, the best. And so what does that mean? It protects our cells, helps improve cellular function at all levels. And so we've talked about this stuff: immune function, hormone function, mitochondrial function. And so as we develop chronic conditions, illness, infection, pain, etc., your glutathione levels decrease. It naturally exists in the body, and you can get it from some foods. But again, we're dealing with poor biological symptoms, poor absorption rates. So maintaining these levels of your glutathione are not only important for wellness and overall health, but also aids in the recovery and healing process. So we will be using this for a lot of things. Those of you that have had Ozone IV or other IVs, a lot of clinics will chase it or will follow it up with an extra 15-20 minutes of dripping this into you, basically because it increases the effectiveness of everything that dripped in before. And so, however, there's also And we will have some of this available, and especially with NAD, by the way, but a lot of these, sending you home with a glutathione or antioxidant supplement that you can take daily will continue to increase the effectiveness of what we did here. So this is where we can do whatever we want here, but what you do outside of here has to support the treatments that we're doing for complete healing and resolution. So this is a pretty simple one. It's extremely powerful antioxidant, extremely safe, aids in just about every function in your body. But again, not standalone. So when used with other things, you know, ozone, your Myers cocktail, your NAD, your chelation, your whatever, glutathione's probably almost always used whether you know it or not, because of how effective it is. So these are probably the three that I felt like we should touch on, because they're probably the three that with a lot of our patients will be using really often. Just to highlight a few of the other blends that we'll have, and we'll have several, but an immune boost and vitamin C, zinc, glutathione. Again, we can add to this, right? We can add, you know, we can add selenium to this, we can add other things, but this is, you know, the basic blends. And one that they call brainstorm, basically it helps to improve cognitive function. So we're adding in some amino acids and things in there. So a hydration, you can call it whatever you want, they call it quench, but basically we're putting hydration and fatigue. This is a really, probably the other really common ones that you hear, high dose vitamin C with a good amino acid and mineral blend in there. Electrolytes, we're just getting that. So people have been sick for a while and throwing up for a while. These are the types of things that we're going to give you. High performance, heat, etc. Recovery and performance. So the IVs are used very often in the athletic performance community, because we can decrease recovery times as well as increase performance by getting those nutrients absorbed. So these and others will have at our disposal, along with, you know, potentially a long list of other vitamins and minerals we can add to, and do intramuscular injections where needed to treat you. You know, all this stuff's cool, but all this stuff's important because of you. And, you know, my and our team's passion and vision to really help you live the life that's most important for you. And I wouldn't add or be here talking about this stuff if I didn't truly believe that it helps and can help in that. Just kind of a brief overview of some of them. We'll have others as we come in, and we'll send information out as it happens. So how we offer it here, this is the end, you know, kind of the big one, you know, what does all this cost or whatever. We've tried to stay pretty reasonable and pretty competitive in this market to stay low. For those that are familiar with the Bio Advanced Clinic, our ozone prices are the same as theirs. So on the side, you can say single use pricing, and then we'll also offer different packages. NAD, by the way, most places around here will charge $500 to $600. Part of the reason, guys, the actual medicine, the actual NAD itself is ridiculously expensive. It works, but it's ridiculously expensive compared to everything else. It's like 10x the cost. So that's the other reason why when my patient came in and they're like, they told me I could do it every day. He's like, I'm not paying for that every day. And also, you know, as we work with you, I'm extremely mindful of that, right? If I truly feel like it's beneficial, I'll tell you it is. But also I'd way rather do that once every 6 months, right? Than, you know, 7 times a month, you know? That's why, and, you know, Joey mentioned it in some of the certifications, they talk about these addiction recovery programs where they're dropping high dose NAD every day. I mean, these programs cost 15 grand, but I guess if you get to a place where you've relapsed and nothing helps and you're on your deathbed, and you know, you're going to make some choices. We are not there, hopefully. But that is lower than most of the other IV places around, because if it's beneficial, I'd rather have you be able to do it than not. And then we'll offer everything, you know, 10 packs, 20 packs, of ozone. Part of that is purely because of where the effectiveness really happens for ozone therapy. It's accumulation of dose, but in the 10 to 15 IV range based on dosage is where the real effectiveness sets in, and that's based on the literature. So you kind of see and look, you know, what's there. We've emailed out about it. We've changed it a little bit, but we're also, you know, pre-launch as we get going here. If this is stuff you're looking into, and I'm happy to talk about this with you. But between now and the end of the month, anybody who pre-buys any type of package, we'll offer 10% off those packages for you, going, you know, at that point. So fairly straightforward, I hope. That's kind of where we're at. Any questions here about anything we've talked about? There's some good questions. I hope we'll learn some things or gain some things, and I'll stick around afterwards. Any other questions that came through these two?
We're a little lagging, but as of right now, no.
Just
Okay.
excited people.
Okay, so if you're online, Zoom or Instagram Live, go ahead and keep sending in questions. And, you know, we'll either answer them personally or in a group email. Other than that, online people, thanks for coming in. Thanks for attending. We'll probably shut down the online. I'll stick around. Joey will stick around if you guys have questions about yourselves or anything like that. You know, I know you guys really well, so we can kind of talk what and how and might work. People online, if you have questions about yourselves, what might work for you, you know, let me know. I'm happy to hop on a call with you or whatever. We can figure that out. Last thing, did you already shut those down yet? When will we start? That's a great question. Really, we have ordered everything, and now it's just as soon as it gets here. We'll be offering services Monday and Wednesday. For now, you know, as need, demand, etc. increases, we'll change that. We'll call and schedule those. Jody will be the one handling those with you, consulting with you, doing the IVs, injections, those types of things, blood draws. So we're literally just waiting for stuff to get shipped. So if tracking is correct, our goal is to be ready to go by next Wednesday. You know, we've received some things, we're just waiting for the rest. For those that are here, have been in the office, this room in here we'll have set up as our IV room. We'll have, you know, recliners in there. You know, everything will be set up in there for Jody to come in and do what you need. So so as far as that part, so we've had a few people that are like, hey, when are we starting? I mean, quite literally, it's like when we get the products here, Jody and I will get everything set up and organized, and we'll rock and roll. So hopefully next week, it might be first week of April, just kind of depends. So stay tuned on that note. And but once it's here, we're ready to go. We're ready to go. Anybody that's doing any type of shipping in the last 2 years knows that that's, you know, super fun. Prime doesn't exist anymore. Yes.
We have another question about, so if people have gotten their blood work done at another clinic such as BioAdvanced, can they use that blood work that was done to help make decisions here if they bring that paperwork?
Yeah,
in?
so I'll defer to Jody. By all means, bring it in. If there's stuff that's not on there that she feels like we need to do, I'll let her talk about that with you. You know,
If it's within the last year, it's okay.
yeah, so as long as within the last year, and sometimes there might be other things we need to look at, so I'll let her
Depend on what we're talking
work
about
with
here.
that with you. We will have a lab draw station here, and we'll just consult with you on all of that as far as, you know, cost, insurance, you know, whatever. If you want to do it here, if you want to send you somewhere, we'll figure that out when we get to that point. But if you've had labs done in the last year, bring them in. You know, for the most part, they'll be the same unless something dramatic has happened.
Yeah.
Right? Sickness, illness, you know, false positive tests. I've had a few of those. We can talk about that offline. Okay, good question. Anything else from the onlines? Okay, I'll let you guys handle that. You want to let it roll for a minute or two in case questions come in. Thanks for chiming in. You guys, thanks for coming. What was your name?
AJ.
AJ?
Yeah.
You got AJ and DJ? Guys, that's cute.
Are you brothers?
Cute.
Kind of back.
This is my sister.
Yeah, you're the only one I know. What you have done to your knee?
I had some, yeah, okay, yeah, so I was, I was training for the Navy SEALs and jumped out of a plane and just parachute didn't come out of it.
Probably not that cool.
Yeah, no, I actually was petting a dog and I just stepped laterally and
Let's get that tell us
dislocated my patella and tore my MPFL.
And
so,
PFL, who did the surgery?
Dr. Wallenstein,
Okay.
Friday night, so,
Oh, wow, fresh.
yeah, fresh.
Well, I'm glad you got out of the house. Thanks for
No, I
coming.
know, I'm glad I got out of hospital.
Yeah, yeah, you're still with us. Thank you. Okay, well, you guys that are here, I know the three of you really well. I know DJ and, AJ, I'm glad you're here.
Yeah, I appreciate it.
If you guys, and I know I've talked to, I haven't talked to you, but I've talked to your wife, if you guys have questions about how does this fit in.